Let's take a look at the latest coronavirus data. 41,346 new infections were recorded in the most recent 24-hour period. Another 1,295 deaths have been announced, bringing the total number of people who've died with COVID-19 in the UK to 88,590. The number of people vaccinated in the UK has now passed the total number of positive tests, with just under 3.6 million people having received their first dose. Well, let's speak now to Professor Devi, Sridhar, Global Public Health Chair at Edinburgh University. Good morning to you. Positive news then, seemingly the vaccination programme moving ahead with speed, but many have said that you can't simply vaccinate yourself out of this pandemic.
Yeah, I think that's really fantastic news, and people should be feeling optimistic because the vaccine program is rolling ahead. Full credit to the UK government for acquiring the doses and getting them out as rapidly as they can. We need to remember these are people who have just had, most of them, only one dose of the vaccine. So when we count it, we need to make sure they're all being given their second vaccine within the next 12 weeks. But it is a really tricky situation to rely fully on a vaccine, given everything we don't know yet about the vaccine and also what the virus continues to do and evolve.
And we still don't know, I think I'm correct in saying, whether the vaccine prevents transmission. We know that it can lessen the effects if you do actually contract COVID-19, but it doesn't prevent transmission.
Well, we don't know exactly. So that's what vaccine manufacturers like Pfizer are studying. We don't know three key things. The first is, does it stop someone being infectious, which is incredibly important if we want to work towards some kind of herd immunity, because that means the virus stops transmitting. We know it stops people getting severely ill. The second thing we don't know is does it stop long COVID, the morbidity associated that some young people seem to have who get chronically ill. And the third thing is how long immunity lasts. Ideally, people would be, vaccinated and be fine for years, like we have with measles and mumps and rubella. But actually, it's more likely you would have something like a every year or every 2-year vaccination program, given coronaviruses have notoriously short immunity.
And there is the possibility, I believe, to be able to contract it twice.
Well, this is kind of what's worrying scientists, not to freak people out on a Sunday morning, but in Brazil, the virus tore through a poor population and about 70 to 80% of people got it, mass death, mass graves, incredibly tragic. And then we thought that, okay, we've reached some kind of level where it's just gone through and it's over. But now we're seeing it going through again with a new variant. Some people might have heard of the Brazilian variant. And this is now, it seems like there are reinfections occurring. So this is what's worrying about this virus. It's like SARS-CoV-2 version 1 in 2020. And 2021, we might see version 2, version 3, and we are seeing various variants. And right now, it's kind of the race of vaccinating people fast enough and then protecting those people from any new variants that might come in as well.
Yeah, and that's the government's emphasis. Much made of the idea of COVID hotels that's been reported in the press today, where people travelling into the country would be quarantined within hotels. Do you think that's a good idea and something that we should be looking to do?
Definitely. We know that aviation has collapsed. It is a tragedy for all those in that sector. And there is a longer term plan needed of how we support actually airlines and people who work within that business. But given it's collapsed anyways, we might as well take the public health benefit of actually making sure we don't bring in new strains that mean that we go back to square one and our vaccines don't work, or we have to change the vaccines to get ahead of it. So I think, looking at the world over the past year, the trade-off for countries has been, do you get back to normal life? You got your parties, your live music, your bars, your pubs, the domestic economy recovered, but international mobility is sticky. Or do you keep yourself open, like a lot of Europe has done, but you live under restrictions, and we have been living under restrictions for almost a year now. So I think right now the tide is turning and people are saying, well, actually, I'd rather be able to visit my neighbor's house and have my kids in school and be able to have, most people in jobs domestically than be able to go abroad to see family or friends or on holiday.
And things like test and trace will allow that to happen. Where are we with that? How effective is it? How many people have signed up to the app, and do we still need it?
Well, test and trace works when your numbers are low enough. So right now we're at a stage, I mean, it's coming down, but recently, 150,000 people were estimated to be infected in the UK, 1 in 20, 1 in 30 Londoners. At those numbers, test and trace doesn't really work. You just have too much infection. But what you want to be seeing is a strategy of how we move through this. So phase one in winter, we have to make sure the NHS doesn't collapse. We have really harsh restrictions. We need to lift those as quickly as we can because obviously they carry huge harms. Then we move into when the infection numbers come down, like where we were last spring, last summer, and there testing and tracing is absolutely vital. But not only tracing, but isolation. And this comes back to the hotels. One of the Achilles heel has been this isolation where people are told to isolate, but just don't. And you can understand why. I mean, if there's a financial penalty and if you don't go to work and you're feeling fine and you're going to lose money, why would you stay home? It's an act of goodwill. So I think we need to be working towards almost like a furlough system for isolation where you get paid, 80% of your salary to stay home because you're doing it to help others. You already have the virus yourself. And so we have to compensate goodwill through thinking through, okay, we already have a system where people are furloughed. Can we just redeploy that to actually paying people properly?
Yeah, interesting idea, Professor Devi Sridhar. Thank you very much for sharing your expertise with us. Thank you.
Thank you.
Kremlin